Hello dear patients, today we are going to review the multi-infection problem with which the patient came to us. He came with several complaints already. First of all, he had some discharges and itch in the area of urethra. He also had reddening of glans penis, and thirdly, in the base of penis, he had Condylomas acuminatas. He didn't note them, thinking that these are moles. You can see it on the pictures. These are reddenings of glans penis and foreskin. These are reddenings of urethra and some discharges, and these are Condylomas acuminatas in the base of penis. I already said several times why Condylomas acuminatas are located at the base of penis. The reason is that condom ends there and it wraps penis by its ring during sex, so human papillomaviruses more actively invade in this area of base of penis. Therefore, Condylomas acuminatas are often located there, as in this case. So patients who think that they got rid of everything after putting the condom on are wrong, as syphilis and sometimes HIV, herpes and many other infections transfer through a condom. Indeed, it lowers the probability of many sexually transmitted infections, even HIV. It reduces the probability of HIV by 80%, according to data of American Medical Association, however not by 100%. Indeed, this is a good and reliable mean, but it doesn't guarantee the absence of different sexually transmitted infections. Analysis for sexually transmitted infections were taken from this patient, from the surface of rashes, from the surface of condylomas, from the surface of reddenings, and from inside the canal. Smear tests for flora and culture tests for bacteria were taken. As a result of that, human papillomavirus of 6th and 11th types were found. There are two of them in high concentration, 10 to 6 and 10 to 8 power concentration. Secondly, leukocytes were found in smear test of up to 25-35, which corresponds to subacute inflammation. Mycoplasma hominis, Gardnerella vaginalis, and Candida albicans or candidosis were found. So such infection was found in the patient, and considering the presence of leukocytosis and clinical manifestations, all infections were due to clinical treatment. The treatment was done gradually, step by step. Candida, Gardnerella, and Mycoplasma were treated simultaneously. They were localized in urethra and glans penis. The course of treatment took 20 days. This was a classic course. It included instillations, injections, tableted medications, external ointments. Later on, we took a break for 20 days, during which a removal of condylomas was done first. Then control analyses were taken for this infection. Control analysis for HPV were not taken, as its treatment was not done during the first stage. After immunogram and general blood analysis, a course of immune therapy was done with observation for human papillomavirus and Condylomas acuminatas. What does this case tell us about? It tells us that on one and the same sexual organ there may be quite a large number of infections. They act quite synergistically, and Gardnerella on its own may have not given such inflammation inside the canal, leukocytosis, etc. However, while acting all together, such infections often lead to complications like prostatitis and lesion of testicles. The same is true for women. It often leads to infertility for both men and women. So a regular doing of analysis, even during an absence of clinical manifestations, can get you rid of the presence of so many infections at the same time. If it's necessary to diagnose and treat different rashes in the area of sexual organs, as well as sexually transmitted infections, you can consult venerologists, urologists, and gynecologists of our paid medical center of Dermatov Neurologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of such pathologies. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.